The fascia responds really well to treatment with the instrument, and essentially what we're going to be working is a little bit of the thoracolumbar fascia and then a little bit of the erector spinae aponeurosis as well. Now for this one, what we do is have the client go down into child's pose. So they're going to sit back just like that, and then they're going to drop down. And for this one, you can do it seated or you can do it standing, just whatever is more comfortable for you. As always with the instrument, you want to get in there and use some motion. The key here is you want the arms to be up. You don't want them down on their side. And sometimes what we can do is get even more tension. Say I want to work this right side, we can have them bring their arm over. That'll really get that to open up. So I get a lot of lotion in here. You want to have a lot of lotion in this area. And then what you're going to start to do is kind of landmark the different spots in here. So that fascia over here is what's called the PSIS. And then over here is the bone. That fascia kind of lives all the way through here. So what I'll do is I'll have my hand over here as like a landmark to know that I'm not going into the bone as well. And basically with this, as you get in there with the fascia, you're going to sink in and you're just going to do some scans and really try to find where some of that grit is. And when there's some grit in that muscle, that's where that scar tissue is. But you don't want to go over the bone. If you go too far there, you're going to actually cause some problems and push back into the bone and through here. And you want to get in there and really just start to clean up some stuff and see what you find as you open that up. And you're going to get a couple of those passes on here. So say you find that grit really bad in here, what you're going to do is sink the muscle, what you're going to do is sink the instrument just below that, and you're going to pull through there. It's kind of like you're getting some of that external slide on there as well. So we sink in, open that up, and sometimes what I'll do is I'll hold that skin back a little bit. That'll get that to really open up, and you're going to get in there until it gets red, and then you know that it's had enough. And you're going to check different areas, basically from up to where the ribs are and through here. And you can find those ribs on the side there. And this will be kind of your landmark. You're going to get in here and scrape away some of that fascia. And as you scrape away that fascia, you're getting that scar tissue out there. It's going to allow you to get into the next part of the treatment, which is actually some hands-on treatment in the deeper lumbar erector muscles.